Most people have come to Park City because they have found a spectacular way of life, a beautiful place, fun year-round, and the concept of having a hospital here in Park City is absolutely phenomenal. Great relief, especially for people like us. We have 4 children. We're very comfortable now in having other family members come stay, older family members, grandparents.
Some of the other impacts in the community include the number of patients that have been able to get care here at Park City Medical Center. We've had over 30,000 patient encounters in just over a year of operating the hospital. We employ nearly 300 employees here at Park City Medical Center. Their salaries are regenerated in a community multiple times. We have over 170 physicians on our medical staff. We have volunteers, and so we've created an opportunity for well over 120 people, teenagers and adults alike, who are interested in giving of their time to the community. We've delivered about 175 babies here at Park City Medical Center, and all of those would be mothers in labor heading down a canyon, sometimes in snowstorms, trying to get somewhere to deliver their babies. We also have provided a significant amount of charity care. So far, in just over a year, we've provided over $2 million of charity care services here in the general Park City area, Summit County area, to people who have needs.
Economically, I think it's been a huge boon. It's affected the stability of Park City, especially during this difficult economic period. It's affected people's property values.
Although the addition of Park City Medical Center to this community has been a long time coming and very beneficial, there are still patients that require ICU care that have not been able to get it in this community.
It was a Tuesday morning. I was getting up, getting ready for school. I had already showered, done my hair, and I was putting on my makeup. And all of a sudden, I would wake up and realize that I'd fallen asleep and be holding my mascara in my hand. And I did this several times. And finally, I called a friend because Dennis was out of town working. And she came to my door and knocked and finally woke me up and drove me to the emergency room. And when we got there, Lisa Saturnino was the doctor on call, who I owe my life, my health. My cardiologist is shocked and amazed that with my symptoms, she realized I was having a stroke.
They saved her life. I'm convinced that Virginia is with us today because of the skill and the care that she received at that hospital.
They life-flighted me down to Salt Lake. This was very traumatic for me to have to be life-flighted. And it was difficult. My family, my friends are up here.
Because we didn't have an ICU here at the hospital in Park City, I was driving twice a day or 3 times a day to Salt Lake to see her and take care of her and then having to come home. We had a lot of people who wanted to help us, who wanted to come to the hospital, who couldn't lend support because they couldn't get there.
Although we're 30 minutes to Salt Lake, we are 30 minutes to Salt Lake. And especially when it comes to trauma and critical care, time is the most important thing that determines whether a person's going to have a good or not so good outcome. The ICU will support the emergency department. The emergency department will support the ICU. It does not limit the time between physicians because the continuum of care is fluid.
I'm just going to shine a little light here in your eyes real quick.
The addition of an intensive care unit will not be as difficult because we don't have to recruit additional nurses and physicians. We probably will get some, but I was impressed with the level of skill that's already in this community and working in this hospital.
The space is shelled in and we will build out within the current walls of the hospital. This first phase will be a 4-bed unit, which will initially build out half of what the ICU will be in the future.
You want one of the Harry Potter books and we can read it tonight?
There's absolute evidence that having the support from your family, being able to see family members when you're hospitalized improves how well you heal, how effectively you heal, how quickly you heal.
The new intensive care unit comes right on the heels of opening a new hospital. We just opened the medical center a little over a year ago and of course invested a substantial amount of resource to build this beautiful facility, equip it, staff it, and provide services here in our county. We found a need immediately after we opened that has been further validated as we've watched our patients and taken care of what we can provide here, and therefore need an ICU to support that. Since we've just invested the resources we have, we need help to raise the money necessary to build the $2.4 million ICU that we need to add here at Park City Medical Center in the very near future.
In the process of defining what our campaign is, it's been, let's introduce this to the community. Let's introduce the hospital to people who can make a difference. And we find that the next step is just a logical one. How can I help? The hospital being one of the most important amenities that we have in Park City, and being able to give back a little bit and to be able to be part of what I think is becoming a legacy.
With national reform efforts, with the economy that has become more difficult, more and more people unemployed, increasing numbers of people uninsured, increasing need for charity care to meet all of the needs in our community. This is a time of course, great concern for many leaders, but also an exciting time as we focus on continuing to build and evolve a healthcare system that's sustainable and meets our community needs. With the challenges and pressures that continue to come to keep healthcare costs down, there's no more important time in the history of healthcare to engage philanthropy as a part of our efforts to expand and sustain essential services than at this point in time. Thoughtful donors look for successful organizations where their donation can really make a difference, expanding services or enhancing what's available, and this is one of those opportunities. Park City Medical Center is governed by a local board made up of people from Summit County, interested citizens who want to be a part of expanding healthcare services and are willing to give their time. Park City Medical Center is also part of Intermountain Healthcare. Intermountain Healthcare is an independent, not-for-profit hospital corporation. One of the benefits of being a part of Intermountain Healthcare is the clinical programs. Intermountain Healthcare has become nationally known for its clinical excellence and the structure of clinical programs that provides expertise to ensure that the services we provide are provided at the highest possible level of quality and care to get the best benefit and outcome for the patients who seek their care at Park City Medical Center.
I think as a board, we're thrilled with the success that we've had in this campaign so far. One of the first groups that was organized was the employee group, and we were shocked at how quickly they met their goal. And I think part of that is because people who work at the hospital, the employees, the doctors, the nurses, they recognize what an incredible facility it is.
We still have a ways to go, quite a ways to go. We're just in the beginning stages here, and would encourage you to consider supporting us, helping us reach this goal and expand healthcare services in a meaningful way.
It's wonderful to be able to really see where your donation's going, to see where your generosity is going, and be recognized, to go on that donor wall and have it be permanent, to have your grandkids go there one day and say, hey, look, there's Grandpa, and he was involved in this hospital. What a neat place. I hope that as you get to know the hospital better, that you'll join us in this campaign.
It is a great hospital. I am forever grateful to them for all they've done for us and for our family. It would just help the community so much if we had an ICU.
We need to have an ICU in Park City for our residents, for our friends, for our families, and for our visitors, because that's part of our culture. There's a great fabric to life in Park City, and you want to know that you've got that peace of mind that comes from having that healthcare service, the ability to save lives, the ability to make a difference in people's lives. Bringing an ICU to Park City is a way for people to help, people to give back to the community, no doubt about it.